Hello, everybody. One second. My name is Jaylen Culver, and we will be talking about how to become a PA and how slash what the job encounters. So I talked to Professor Raymond about doing this again. I did take a class last semester, so we did something like this, kind of similar to this. Um, so I'm going into more depth into what I want to be in when I get out of school. Um, this is the career path that I want to take and what I did. So I'm gonna include what I've done uh, here at Siena Heights, and hopefully y'all learn stuff with this. So this video is kind of like a part two per se. My part one to this is on my YouTube channel, and I will post this when we are done. So hope you enjoy. Let's get right into it. So earn a bachelor's degree. In order to become a PA, you need a bachelor's degree. Most PA programs require a bachelor's degree, typically in science related fields such as biology, chemistry, and health science. It is important to complete prerequisite courses, which often includes anatomy, physiology, biology, and microbiology, and chemistry also. I would want to include that taking some psychology classes and communication classes will help you in this field just because I feel like communication classes will help you learn how to talk, present yourself to patients, how to um, present yourself. And psychology is just what I think psychology for this particular field is learning how the mind works. Some patients are going to be hurt and they are going to be freaked out, learn how to talk to people. Um, Learning the proper terminology. Oh, another thing too is taking another prerequisite in medical terminology. You're going to need to know your medical terminology. But yeah, gain health experience. Most PA programs require health experience, either paid or volunteer. This could include work as a nurse, EMT, paramedic, medical assistant, or scribe. The number of hours include required varies from direct by your program. Direct patient care experience is highly valued as it provides a foundation to your clinical experience. So, I will be attending Eastern Michigan PA program next coming fall, and their volunteer hours are 500. And I did it my junior year, working with my auntie uh, as a nurse under her, and also I am after I get my bachelor's degree here, I will be trying to apply to be a medical assistant. So yeah, as I'm going into, I haven't got my 500 hours yet, but I'm close. I think I need like 100 more, 150 more. But they see that I'm working towards it, so that's why I got accepted to it. Um, Also, to complete for your master's degree, PA programs are typically 2 to 3 years long, including classroom instruction in medical science, pharmaceutical, pathology, anatomy. Clinical rotations varies specialties: family medicine, internal medicine, and surgery. PA programs in a master's degree, such as a Master's of Science in Physician (MSPAS), or Masters of Physician's Assistants Practice. What I will be doing will be Masters of Science in Physician's Assistant Studies. Um, they're pretty much similar. With the practice, you're going into getting your own, like you want your own practice in uh, physician's assistants. Which I mean, you could do it with the physician studies too, but I want to go into more specialties, and that's why I wanted to be an orthopedic. I want to be an orthopedic PA, so that's why I chose this physician assistant studies. Uh, so in order to get after you pass all your classes, you're about to graduate, you have to take the PANCE, the PANTS test. It's a national commencement or certification for physician assistants. It's a comprehensive exam covering medical knowledge and clinical skills. You have to pass it in order to get your license. It's a must thing you have to do. Okay. So after passing the pants, you must obtain a state license to to practice. Each state has a specific requirements, but all require graduation from an accredited program and passing the pants score. Continuing medical education (CME) is also required for maintaining licensure. So with me, I haven't done any research, and through the time I do more research on this. I do not want to stay in Michigan. I want to move as soon as I get my degree, so I will have to know what state I want to move into to actually uh, know what the requirements is for this. So. So in order to maintain, you have to actually maintain your certification to continue and continue your education. So to maintain your certification, PAs must complete 100 hours of CME every 2 years and pass your physician's assistant nationals recertification exam, the PANRE, every 10 years. Uh, PAs also pursue specializations and advanced uh, credentials through addition, certifications, and fellowships. So in other words, you're going to have to keep studying and keep on this thing because this is not an easy job. This is a very complicated, always on your toes type of job. But if you love what you do, you would do it. So like I said, this was a part. That whole thing was the part one to this. So I put the references from part one and part two and just this. So I added the part two after the references, just so I didn't have to delete stuff and all this stuff. So everything is on here with the references and everything. So part two to this. What is a PA? So I think y'all should know what a PA is. PA is a physician's assistant, licensed healthcare profession who works with doctors to provide patient care. PAs are an important part of a healthcare team, providing a wide range of special services. So a PA it's not its own thing. You're always going to have a doctor. You're probably going to have three PAs to one doctor, or you're going to have five PAs to one doctor. You have an orthopedic PA, then you have a surgery PA, then you have a family care PA. So you're going to have different PAs under one doctor or two doctors, whatever the situation is. So the services with the PAs perform physical examinations, diagnose illnesses, order and interpret lab tests and X-rays, assist in surgeries, prescribe medicine, develop and manage treatment plans, advise patients and prevention care. I'm sorry. Take patient histories, counsel patients on healthcare issues, and record process notes. Uh, where do they work? So PAs work in hospitals, clinics, and clinical practices. They practice in every state. I'm sorry. They practice in every state in a wide variety of clinical settings and specialties. PAs are licensed to practice medicine with supervision from a doctor of medicine, an ND, or a doctor of osteopathic medicine, DO. So, like I said, we're always going to be under a doctor. Um, it's funny because like a PA does the exact same thing as a doctor, but we just don't have doctor by our name, which is okay. It's just less schooling, and maybe when I get my PA degree, I'll consider going back to school. But right now, I feel like PA is where it's at right now. So the salary. A physician's assistant in California makes about $150,000 annually because of a high cost of living. Alternatively, a PA in Oklahoma earns up to almost $100,000 due to low expenses. So Michigan, like I said, I do not want to live in Michigan, I want to go down south where I'm originated from, with my family. Um, but to me, the money doesn't really matter to me. I love medicine. I love medical. I love hospitals. So when you love something, you don't think of it as a paycheck. You wake up every day like saying like I want to go. I want to go to work. I want to do this. So that's how I think of things. The difference from a PA and an ND. PAs complete a master's level program that usually takes 2 to 3 years. MDs complete a medical school, which takes at least 4 years, and the residency fellowship training can take 3 to 7 years. PAs receive training in basic sciences, pharmaceuticology, clinical medicine, and behavioral science. They also complete supervisory clinic practices. MDs receive extensive training in medical school, residency, and fellowship training and gain patient care experience. Is it a good job? Being a physician assistant is regarded as a very good, frequently ranked among a top healthcare job overall. According to the recent U.S. News, I'm sorry, and World Reporting rankings. Good work life balances, competitive pay, and a variety of practices options across different medical specialties, contributing to a high satisfaction. Sorry, someone's outside. I don't know what's going on outside. Uh, Continuation of that. High job satisfaction. Many PAs report high level of job satisfaction due to ability to direct impact patients while calibrating closely with physicians. Starting job markets, the demand of PAs is constantly high, leading to good job security, potential for career advancement, competitive salary. PAs typically earn a good salary with the potential of increase based on experience and specialization. Oh, they stopped. A variety of in practice, PAs can choose to practice a uh, various medical specialties depending on their interest. Work life balance. Comparing to some other medical professions, PAs often more manageable schedules and better work life balances. I'm sorry, the noise got me all messed up. Also, there's always pros and cons to something. Why is being a PA hard? Rigorous training. PA school demands a demanding and competitive, requiring a high level of academic performance. Supervised required. PAs typically practice under supervisions of physicians, which can vary depends on the state of practice, which makes sense because we're not doctors, so we can't do what doctors do. But at the same time, it's like it's whatever. You know what I mean? Benefits. Among the many advantages of working as a physician assistant, the job security flip. I'm sorry, 1 second. Security employment, great demand of job market and predict the expand the PAs are great demand. Primary care PAs work and these professions may enjoy career stability because they're in deep breadth of primary care physicians. Adaptability. Uh, Work areas PAs can be employed in wide range of medical professions and fields. Hours of work compared to doctors, PAs. This is a really big thing. PAs have more regular hours. So doctors they probably on they can be on call. They can come in. We have actual hours that we have to work. So that's really really good that we don't have to have patients calling us every now the hour or anything like that. Assisting patients, identifying the treatment elements. PAs are able to identify, treat, and monitor patients' recovery and developing Raptors. PAs are able to assist people experiencing pain or suffering. Uh, Versatility, the business assistant offers a flexibility, and you choose a special care and surgery, emergency medicine, dermatology. So it's just you have a lot of fields to go into, and these are all the fields: cardiology, orthopedics. I would like to go on orthopedics. My major is in exercise science.